medical equipments for healthcare professionals and COVID-19 patients in the ICU. So I hope all biomedical engineers are safe and sound. And yeah, so moving on, our Medpick biomedical webinar today is entitled as Biomedical Engineers and the Future of Working in Hospitals. We have with us today on the speakers panel, Mr. Chethan KS and Mrs. Prema Subramanian. Chethan is the co-founder of Medpick and a biomedical engineer entrepreneur himself. He had started the biomedical initiative in Medpick in an attempt to help biomedical engineers across the globe. Our other speaker, Mrs. Prema Subramanian, is a medical equipment officer at Chinmaya Mission Hospital. She has had over 19 years of experience in the industry, including work experiences at Electrocare, BMGH, and now at Chinmaya Mission Hospital. So first up, we have Mrs. Prema Subramanian presenting. Prema, ma'am.
Am I audible?
Yes, you are. Yes, you are.
Good morning, one and all. Thanks for the introduction, Sumana. As Sumana introduced me, I'm heading the biomedical department as well as the procurement of medical equipment in Chinmaya Mission Hospital, and I'm a certified internal auditor for NABH, CPQI, and CAHO. Hope you're all fine in the COVID pandemic. We, the biomedical engineer, are playing a significant role by arranging and servicing the biomedical equipment in COVID ICU wards with the available resources. Hats off to all the biomedical engineers. And coming to the topic given to me is roles and responsibilities of biomedical engineer. First, we'll see what a biomedical engineer will do. Like any other engineer, a biomedical engineer is a primary concern with solving the problems that specializing in the field of biology and medicine. Biomedical engineer focus on analyzing challenges and designing efficient and effective solution to improve the patient care. So the motto of the biomedical engineer is to provide a safe and calibrated equipment to the patient use. Through that, the quality of patient care can be achieved. Next, we'll see the medical equipment categories. So in that category, 4 categories will come. One is a life support equipment, therapeutic equipment, diagnostic equipment, and general equipment. Now we will see few of the images of life support equipment. In the life support equipment, our ventilators, defibrillators, cautery machines, portable transport incubator, heart-lung machines, those things will come under life support equipment. In therapeutic equipment, few images are here. Our infusion, syringe pumps, and all our physiotherapy equipments like stimulators, continuous passive motion apparatus, and shortwave diathermy, and traction apparatus, those things will come under this therapeutic equipment category. And next is the diagnostic equipment. In the diagnostic equipment, as you know, all our lab and imaging equipments and the ECG machines and laparoscopy equipment, those things will come under the diagnostic equipment. In general equipment, as you know, all the BP apparatus, weighing machines, stethoscopes, suction apparatus, those things will come under this category. So now we have seen the categories of equipment. You people think, is that easy to handle all the category of equipment from the basic surgical instrument to the high-end equipment like CT, MRI, PET scan, which cost around some 6 crore, 7 crore like that? Yes, of course, it is easy. Only thing, we should have the correct protocol, policy, and procedures. Then it is very easy to handle the biomedical equipments. Now we will see the functions to accomplish equipment management. So what are all the things we need to maintain to efficiently run our biomedical department? First and foremost, all the statutory requirements we need to accomplish. For example, if your organization is running a imaging service, it has to be registered in the ELORA website, which is the official website for AERB. So all our institution has to be registered. All our radiology equipment, CT, MR, CT, X-ray machines, and all the radiology equipment we need to register. And periodically, it has to be, quality assurance has to be done, and the same thing has to be uploaded. And next is the asset list and inventory control. If we are having correct, proper inventory control, then our department can run. Previous slide, please. Asset list and inventory control. Nowadays, many asset management softwares are available, which is really a very useful tool for biomedical department. Through that, all the equipment history card, breakdown time, and the pop-ups of AMC, CMC renewal, and PM due, CAL due, those things can be popped up. So through that, we can maintain the history card for the each and every equipment. If we don't have the asset management software, okay, no problem. In simple Excel sheet, you can maintain one asset list. The main motto, we should have a proper asset list so that the biomedical engineer should know how many equipment, if the management asks, how many working ventilator you have. At the spot, you should able to tell, yes, this many ventilators are there, or which is in working condition, which model, when it is purchased, those details, it should be in your fingertip to give the answer then and there. And next one is the breakdown maintenance. You know this, any biomedical equipment, the breakdowns will occur, but if we do the proper preventive maintenance of the equipment, then we can reduce the breakdown time. Okay, no problem. If the breakdown time occurs also, how we are going to handle? For that, we should have a register, proper register. So when the problem has occurred and when it has got completed, through that we will get the downtime, how much the downtime has happened. If the problem is repeating periodically, then you need to make a RCA, root cause analysis, and the CAPA should be maintained so that the problem should not repeat again. And this is the indicator is required for the NABH. During audit time, this is the indicator they will ask how much the breakdown hours for particular equipment and how many times it is repeated they will ask. So this is the main register you have to maintain. And the planned preventive maintenance, this I've told you before, for all the equipment, PMS must. As per the company schedule, we should have the PPM chart for the over 1 year. So whenever the PM is done, so those reports we need to file it properly. And next is the calibration, performance verification, and the quality assurance. As you people know, the calibration of the equipment is must. And yearly once we need to do the quality calibration of the equipment. If you have the tools in your department, it's well and good. You can do the calibration of all the equipment. If not, then we need to call the third-party service to do the calibration, and we need to ask the traceability of the particular equipment, and we need to give one copy to the end user and keep it safely. And the quality assurance. See, for all the radiology equipment, quality assurance is must. It has to be done twice. 2 years once we need to do the quality assurance by the authorized people from the AERB. So those things has to be maintained. And next is pre-purchase evaluation, negotiation, and procurement. For any project, first you need to prepare the project report for the particular department. For example, if your management is planning to do a dialysis department, you have to prepare a project report, and for that you need to take the necessary data. It is how many dialysis machines is going to come. So accordingly, you have to calculate the load for electricity as well as the RO plant. What is the capacity of RO plant you have to put, and what is the AC required? Air condition is must. So what is the air condition ton? How much the capacity it should be there? and whether oxygen and vacuum, those things are there, and other equipments like monitors, syringe pumps, and defibrillators. So you need to prepare a detailed project report with the budget you need to present to the management with the correct data. And we need to take 2-3 quotations that you know, and making the comparative statement and calling the purchase committee, making the negotiation, and the procurement process will start. And next is the utility certification. See, before doing the installation of any particular equipment, for example, the same dialysis department, so whether input water facility is there, and the output drain output point is there, and whether the gas connection has been connected properly and UPS is connected properly, those things we need to check before installation of any equipment. Then we need to plan for the installation, and proper training has to be given to the end user as well as the biomedical engineer. Next. And this I've told you already, creation of computerized database, dynamic software for maintaining work order, preventive maintenance schedule, and downtime. These things is possible if we have the asset management software. Otherwise, manually, we need to prepare this data. But these data are must for NABH, whether it's for entry level or full NABH. These data are must. And this is for next is the planning and procurement of spare parts of breakdown, preventive maintenance, and planned preventive maintenance. We should have minimum stock for the any of the equipment. For example, if you have the ECG machine, you should have at least one ECG cable and bulbs. Some ECG bulbs you should have. For BP apparatus, some BP bladder bulb you should have. So those necessary things should be available, and you should have the stock entry for these things. Next. And next is the equipment retirement. See, these things, you know, for any biomedical equipment, the lifespan of the biomedical equipment is 7 years to 8 years. So any equipment, if the repeated complaint is coming, then we need to see when we have purchased, whether it is outdated model or the spares are not getting in time, whether the service providers are not giving the service. Those things we need to analyze, whether we have to condemn the equipment. If we have to condemn, then we need to call the condemnation committee and make the necessary things. And 12th one is the most important, conducting training program for the trainee, a biomedical engineer, as well as the end user. This we need to do periodically, so that no, the equipment they will use the equipment effectively, and we will not get any problem. In-time service can be possible. So conducting training program is a must. And here I have shown the asset list and then the PM sticker. So in the asset list, we have given the asset number, equipment name, serial number of the equipment, company name. So those things, if it is there in one shot, we will come to know whether when the equipment is installed, this equipment belongs to which department and how many years, all those data can be seen in one shot. So all the equipment should have the asset name. And next is the PM sticker. Generally, the company people, if it is under warranty or AMC, we have taken, the company people will provide the PM stickers. Otherwise, from our hospital, we need to provide the PM stickers. Hospital name, just simple hospital name, PM done, PM due, and done by the company people or by the biomedical engineer, that we need to mention. Next. And this is the checklist. With this checklist, if we maintain these things, then our department will function smoothly without any problem. That is why the NABH has given the correct guidelines, what are the things we need to maintain. As you people know, in NABH, we have 105 standards and 683 objective elements. And FMS will come in the chapter 8. So 7 standards and 56 objective elements are there in FMS. So in the FMS chapter, clearly they have mentioned what are all the documents we need to maintain. so that the smooth functioning of the department will be there and effectively we can use the equipment. First one is the equipment inventory that I told you clearly, asset list, asset tag, and the log. And second one is the license copy of all the radiology equipment and quality assurance report for the radiology equipment and history record for all the medical equipment and training of staff when new equipment is installed. After that also, periodically we need to give the training to the end user and same thing has to be recorded. And PM report and calibration has, as per that schedule we need to do. And SOP we need to prepare for all the equipment and it has to be filed. And the traceability for calibration report, we need to keep it safely. And preventive and breakdown maintenance for the all the equipment. And next is the FMS 4C, color coding of pipeline. In FMS, it will come both biomedical as well as the medical gases also. So color coding of pipeline is must. And the maintenance plan for the manifold room. In the manifold room, you will be having the compressors, air compressor, vacuum compressor, automatic changeover panel, and then this one reservoir tank and O2 plant. So those maintenance plan has to be there for a year period. Next. Here, I have given you the color code for the pipeline. This as a biomedical engineer, we should know. This is for the new engineer, biomedical engineer. White color for oxygen pipeline, and for N2O it is blue color. For vacuum it is blue. For air it is white and black. So these color codes should be there that we need to check. Next. Here, I've given the medical oxygen flow chart. As a biomedical engineer, we should aware of these things also. Whether we have the liquid oxygen or bulk cylinder. In certain hospital, all the three sources will be there. They will have the O2 plant, which is having the capacity of 30 to 40 cylinders capacity, and they will have the liquid oxygen tank. If they have the liquid oxygen tank, it has to be licensed. Even for the tank, as well as for the installation, it has to be licensed from the PESO. And from the third source will be the bulk cylinder, which is the D-type cylinders. It will be connected through a chain. So these three things will go to one automatic changeover panel. From there, any one source can be connected. So whenever alternate source is not working, if the liquid oxygen is not there, then from the O2 plant, it will, the gas flow will go, and it will, and I've shown the indication for alarm as well as the visual indication. These things should be mandatorily should be there in the gas room, O2 plant, and casualty, ICU, and OT. These are the mandatory places. Visual and audio alarm should be present for O2, air, vacuum, and for N2. And all the flows should have the safety valve. So whenever any problem occurs, no, so that particular division alone we can close and then do the maintenance of that thing. So this is a basic medical oxygen flow chart. Next. Now we will see how can we raise our departmental potential by upgrading your knowledge by attending conference, webinars, training program, and conducted by CAHO, CPQA, official website for NABH. So by attending these training programs, we can update our knowledge and what all the new technology has come, new equipment has come in the market. So we have to upgrade ourselves, and the same thing we need to intimate to our management. Whenever new technology has come, we need to intimate our management so that the new technology can be incorporated in our hospital. And next is the continuous training to the end user. This we have to make mandatory so that no any problem we can the end user itself will solve the thing. For example, I'll give one COVID positive patient. They want to take one X-ray machine. The X-ray technician should be thorough enough how to handle the COVID positive patient, how to use the X-ray machine with a COVID positive patient.
So he has to be fully PPE, and the cassette, whether it is DR cassette or CR cassette, it has to be covered with a biological cover with a yellow color cover, and after exposing, the same thing has to be disposed in the yellow color bin. So those training programs we need to give to the X-ray technicians. And update our inventory management. If you have the inventory management software, it is well and good. It will update automatically whenever we are entering the data. Otherwise, manually, we need to update the data. Then only the correct data or missing of the equipment will not come. And yearly once it is must. You should check your asset verification has to be done. And any mismatch, then you need to intimate to the management. And next is the proper documentation of the warranty guarantee equipment, CMC equipment, AMC equipment, and other equipments. So proper documentation should be there. So if any equipment under warranty, any problem comes, we have to claim the warranty. So for that, you should have the warranty papers correctly. So documentation is must and should. And next is the in-time service. Whenever any call comes, we need to attend the call immediately, so that the end user will feel, yes, the biomedical team is effective. So any problem, they are supporting us. So these 6 points we have to incorporate in our department. I'm sure definitely you will raise your department potential, as well as your knowledge also will increase significantly. Thank you once again to all the participants and biomedical engineer and the Medpick team for arranging the wonderful webinar. Thank you.
Thank you, Prema ma'am, for such wonderful insights into the roles and responsibilities of biomedical engineers. I'm sure some of you might have questions. So there's a chat option at the bottom of your screen. So you can put in your questions there. And we have a Q&A session towards the end of the webinar. So please hold on till then for the answers. Up next, we have Mr. Chethan KS presenting. Welcome, Chethan.
Thanks, Sumana. Hi, everyone. Hope you are safe in this COVID times, and all the biomedical engineers are taking necessary precautions to during their work environment in the hospital. And I hope you remain safe and sound, continuing your services for the hospitals and for the welfare of mankind. So I'm here to speak about entrepreneurship and biomedical engineering. So I have a presentation for the same. So just let me present my screen for the same. Hi, okay. So I hope everyone can see my screen here. So as Sumana introduced me, I'm a biomedical engineer myself, and I'm an entrepreneur, co-founding Medpick. So I'll be explaining more about my company later stages. So let's see how biomedical engineer is progressing once the graduates come out of the college. So here are the biomedical engineer career pathways. Here you can see biomedical engineers working as FCs, higher studies, R&D, working in hospitals, and entrepreneurship. Here, working in hospitals and higher studies are gathering a lot of attention after students graduate from their college. And because of the opportunities we have given in the hospitals, and the students who are going into R&Ds is a lesser percentage when compared to other sectors. And coming to entrepreneurship, students taking up entrepreneurship after their graduation is still low. So entrepreneurship is a less chosen pathway for engineers who are coming out of college. And we'll put some light on this to see how we can improve on this, and what are the aspects which we can initiate, which can increase the value of this sector for the students who graduate from biomedical engineering. Yeah. So let me put some light on the roles which we perform after coming out of the college. One such role is field clinical engineer. Field clinical engineer are generally employed by industries or manufacturers who tend to use them as a technical lead in their organization. So typically, a sales or marketing staff present a particular product to a hospital. It is the responsibility of the field clinical engineer to explain the technical details for the doctor and help them install the product when the product is higher than the complicated situation. So they facilitate sales and promotion along with the marketing staff, and also they are responsible for clinical studies in the field. Say, for example, an ultrasound is purchased by a doctor. It is a field clinical engineer who has to take up the data of the functioning of the device for the first 2 to 3 weeks and see how the device works. And this helps the industry or the manufacturer to improve the quality and performance through this clinical data. The second is clinical technicians. I hope I don't need to explain a lot regarding this, because Ms. Prema has already explained you on what are the roles and responsibilities of a biomedical engineer in a hospital. So just to add a few points, they do healthcare informatics. They store patients' data. They help in organizing that data. Second is inventory assessment and management. This is the core principle of a biomedical engineer in a hospital. So the engineer helps in inventory assessment, servicing, managing, and in terms of repair and accessories as well. And the third one is interfacing with medical device manufacturers. This is a least exposed field for the biomedical engineers in hospitals, I would say. A biomedical engineer knows each and every device inside and out in a particular hospital. So I would, as per my perspective, I would expect biomedical engineers to work more on the procuring side as well, since they can put more light on what kind of device has to be procured for a particular hospital, and how feasible is the product for the hospital, and what more they can bring value to the hospital by procuring that particular product. So I hope biomedical engineers in the future participate in procuring of medical products for a particular hospital as well. Yeah, so as I said, I'm an entrepreneur myself. This is what we have built as a team. So what is Medpick? Medpick, it's a B2B platform for medical devices. Since I said B2B, it has two sides of the B. One side is the manufacturers and industries. So we have created a marketing platform where manufacturers and distributors can upload their products into our website, and they can expect more sales and online exposure for the particular products. And I'll add more into how this can benefit the distributors. Coming into the hospital section, hospitals can access Medpick as a one solution platform to procure all their medical devices, which will help them organize their procurement segment. So a typical old age regular procurement cycle starts from manufacturer to intermediaries like stockist, distributor, retailer, hospital. So this is where the product price jumps up very drastically, and the procurement cost for hospital increases drastically. So this is where Medpick comes into place, acting as a one solution platform for hospitals, reducing the procurement costs for at least 20 to 30% of what their procurement cost currently it is. So we envision reaching every healthcare business in India, helping every hospital and manufacturer to organize their procurement and sales channels. So as we marketed the biomedical initiative. So what is the biomedical initiative which we have started? So as a biomedical engineer, I wanted biomedical engineers to be a part of Medpick as well, to get associated with us, to work with us alongside working in a hospital, which will help them realize their true potential, and working in multitasking help them a lot and their career span as well. So this initiative basically treats a biomedical engineer working for Medpick as a consultant, helping Medpick achieve its activities for the hospitals whom we onboard as clients. So I'll step by step, I'll let you know what are the tasks or what are the terms which biomedical engineers will be working with us. So one such thing is a chance, if a biomedical engineer is already working in a hospital, it is a chance for him to increase his relationship with the hospital, with not just servicing or just being in a biomedical domain, helping in procurement for his procurement team, helping in servicing, helping in AMC. So the biomedical engineers in a hospital can do much more than what they just do currently. They can associate with all departments and realize the true potential in working in a particular hospital. The second thing is, as I said, they can procure medical equipments for their associated hospitals through us. So we have products ranging from ultrasounds, radiology equipments to COVID-19 essentials as simple as a mask. So whatever a hospital requires for a day-to-day activity, a biomedical engineer can procure those equipments for their hospital through us. And they get a chance to have an asset management software for free. So each and every biomedical engineer who get associated with us as a tech lead with us, so we provide our asset management software for those hospitals who they are associated with without any cost. That will be a very added benefits which you can provide it to your hospital, since we provide this as a free service to all these biomedical engineers. So you'll have performance-based incentives for your activities at Medpick. I'll explain in detail what are the activities you'll be performing in the later stages, and you'll be having AMC contracts for medical equipments as well, which you can take up through our hospital network across India, and I'll let you know on how you'll be doing that too. Yeah. So as a biomedical engineer, you are mostly associated with servicing and repairing, maintaining medical devices inside a hospital. So in this case, you need a lot of procuring of medical equipment, spares and accessories, which will be quite difficult in this situation and ever because of the lack of accessories and space in the market. And this we have come up with a solution where you can just procure all the spares and accessories in a single platform. So once you're a part of our initiative, we give you a login credentials to our platform where you can log in into your credentials into our application, and you can check all the equipment, spares and accessories on a single platform. So you can access all these spares and accessories required for your servicing of biomedical equipments in your hospitals, which is very convenient for you to not run behind vendors and dealers for these accessories. And the second thing is biomedical engineers who are a part of our initiative. So once they log in, they'll have exclusive offers only for the engineers who are a part of our initiative. And I would easily say the cost will be at least 20% less than what the market price is. So this offers only are related to engineers who are a part of our initiative, and others can't access this offer. So how do you do that? So we have an Astra application for that. So we will be sending a mail to all the participants and registrations who are done. We'll be sending a mail to you regarding the application and where you can download this. So you can order, procure, add to quotation, request for price. You can do everything in a single application. You can see the categories of products what we have in the application. It starts from hospital furniture to dental, laboratory equipments, home health, endoscopes. So you can purchase everything in a single application. So as you know, the new era of hospital procurement has moved into online because of the sophistication the application brings to you. And recently in this pandemic, we have fueled it a little bit because all these hospitals are discouraging people to enter the hospital just for marketing stuff. So this is how the online procurement has boosted a lot in India currently. Many of the hospitals are looking at procuring online medications and online medical supplies, which will help them get contactless delivery to their hospitals or non-contact deliveries. So here you can see a typical product page here for a product mask. So regular MRP price is 295 for a box, but for biomedical engineers who are a part of our initiative, they can access the pricing with just 285. If the quantity is high, they can request a quotation by clicking add to cart. So where they'll be getting very much more exclusive pricing because of the higher quantity. And if they wish to place an order directly, they can just buy it over that, buy now. So we directly once you place an order, we directly handle with your hospitals for whom you have placed the order. So we collect payments from them through a credit line system, which we gonna offer for your hospital. In here, you can do much more than what a biomedical engineer can do for his hospital. So you're helping your hospital to procure products. Along with it, you're helping your hospital to service, maintain equipment. So here you can realize your true potential here. So one more other aspect, which is a key feature in our application is every biomedical engineer needs data sheets and product manuals for the servicing, for the repair and maintenance of those equipments. And our traditional method sometimes makes us lose those documents. So in this, every ultrasound, every MRI, to every syringe pump, you access the product here. You will get the product manuals and data sheets, which you can download and refer while servicing. So this can help you act as a master database, which will help you on servicing and take up AMC projects with other hospitals. As I said, we'll be providing free asset management application. So this is how our asset management application looks like. It comes with features like adding departments, adding new products, adding assets. So each and every department you add, say hospital furniture, radiology, laboratory, you can assign a single point of contact for each department, through which you can share your work among your peers in your biomedical domain. So here, the important aspect of this application is that once you add an asset, you can print a QR code for that particular asset and just stick it on the asset or a product. So once you scan a QR code through your mobile camera, you can see how the asset page appears on the right side of the screen. So with the asset, the image of the asset, price, quantity, department, status, sold by, warranty, manufacturer. So these are the few things which you can see for a asset details, which you can see once you scan the QR code, along with which you can see the warranty certificate as well. So it's a one solution access to all your assets in your hospital. This can help you maintain, add your asset, track your asset, maintain it, and service all your equipments. So say, for example, there's a bed which requires a particular service. So you can click on the asset and you can click on require service. So once you click on require service, we get a notification and we send our persons immediately to get the assets repaired or repaired if you don't have the human resource in your hospital to do that. See, these are few of our prestigious partners who have already partnered with us. Few companies are National Ultrasound, Avanta Health Solutions, Medilab Global, Trivitron Healthcare, and I would mention Centurion Group as a honorable mention because the CEO of that company, Mr. Eric Tiven, he's one of our board member in our company, and he plays a very crucial role in our company as an advisor as well. So we have very good connect with the medical equipment companies and medical spares and accessories coming from US and India both. Yeah. So what does Medpick do for FCs and sales engineers who work in industries and who work for distributors? So one access we give for FCs and sales engineers is to onboard their companies with Medpick. You can onboard your company with Medpick, and we will provide an initial first year free subscription if you're working as a biomedical engineer, and if you're a part of our initiative, we would provide a 1 year free subscription for your company to onboard with us and upload all your products into our website and get sales. So you can introduce Medpick as a partner to your hospitals whom you regularly consult with for other products which your distributor which your manufacturing company doesn't deal with. So here every FCEs and every sales engineers has few targets and few restrictions to finish off target sales within a particular financial year. So here you can use Medpick as a partner to achieve that target. You can use Medpick as a partner to bring more sales into the company and achieve your target of a certain number of product sales in your company. And this can help you grow professionally in your organization. And moreover, it'll be a good back-to-back service between Medpick and you. Yeah, as I said, how to increase your upgrade your knowledge, as Prema was insisting on upgrading your knowledge for development of biomedical engineer sector in hospitals. So that is the reason which we have launched health innovations as well on a platform where we publish each innovation per day. So one health innovation per day comes to 365 days, 365 innovations. So we publish one innovation every day, which helps hospitals to upgrade the technology. Who better than biomedical engineers knows about advanced technology and advanced solutions for hospitals? So you can keep on visiting our website, Health Innovation website. You can keep up with your knowledge on latest medical innovations, which can cut costs for your hospitals and make your process much more easily accessible. So you can educate your hospital to advanced tech. One such example I would give us a single ultrasound, a regular ultrasound costs around 15 lakhs to purchase it. But Philips launched a new ultrasound where you can view the image through a Samsung tablet with a single probe. How convenient it is. And the pricing for this product is around 40% to what a conventional ultrasound costs. So if you are aware of this knowledge, it will be you who can suggest your hospital to go for such a products and not the conventional ones, which can help your hospital cut costs and at the same time maintain the quality and specifications for a particular product to use at your hospital. And this can help your hospitals to cut costs mostly during procuring traditional ultrasounds or traditional equipments to any department as well. As I said, so the main aspect of asset management app here is, so once you're a part of our initiative, and as I said, we handle procurements for hospitals across India, mostly small and medium-sized hospitals, starting from 1 bed to 100 bed, 200 bed hospitals. So when we give products to them, we expect them to request AMC services for the products like ultrasounds, imaging equipments, or syringe pumps. So in this case, we have a feature for the hospitals to request AMCs. This notification will pop up with the nearest biomedical engineer who is present in that region under a part of our initiative. So if your track record is well good enough to take up an AMC project for a particular product, say a hospital in Hyderabad requested an AMC for a syringe pump, and you are present in a Hyderabad location, and you get a notification saying hospital, so-and-so hospital is looking for an AMC for syringe pump. So you can click on that and you can just apply for it. So we see your track record, and if it is good enough to process a syringe pump, we give you access to take up that project. And here you can earn something more than what a paycheck can give you at a hospital. So these kind of activities help you develop that entrepreneurship mindset in you, working in a hospital, not just be an employee, but be an entrepreneur yourself. To better your hospitals, to better your industries, and to help them grow financially, and to help them grow in with technology as well. So many of you might be thinking how to onboard or how to be a part of our initiative. So you can download the Astra app. So we will be sending you the link to your emails to the participants who have registered for the Astra app link, or you can just go to Play Store and search Astra. So you'll get the app here. You can keep note of the logo if you are confused on which app to download. And here, once you downloaded the app, you can register as a biomedical engineer, and we check your profile and we approve it. So here you can, after that, you can procure equipments, accessories required to service ultrasounds, syringe pumps, or all radiology equipments, anything starting from a furniture to diagnostic equipment. So the fourth point is you can take up AMCs for medical equipment through Medpick with our nearest hospitals and benefiting yourself to become an entrepreneur. So this is our team. We have Dr. Ranjit Makam, the CEO and co-founder of Medpick. So he has around 15 years of experience working in hospitals, and he has worked with many prestigious organizations like World Health Organization. And we have Dr. Saurjanya Parvatanini, who is a physician in US, and she is a very well experienced physician. And me, myself, I'm a co-founder and biomedical engineer in Medpick, and we have other team members with us here. And as I said, Eric Tiven, he's a board member and advisor in our company, who is a CEO of Centurion Services. Yeah, so I hope I've cleared all your doubts on our initiative, and I've introduced my initiative well to you, and you have understood it well. Although if you have any queries regarding the initiative, you can contact us, and I've given my contact details here. You can contact us, or you can drop a message in the Q&A section, and we'll be answering. I'll be answering to those questions.
Yeah, thank you, Chethan, for such wonderful insights into and entrepreneurship in biomedical engineering and Medpick's biomedical initiative. So, as promised, we have a few questions coming up from our audience. So, first question is, for training purposes, can we go to hospitals or else company? Which is better? So.
I would say it depends upon your career choice, whether you are looking for a R&D section or you are looking for to work in a hospital. If your career choice is to work in a hospital, I would say better you get trained in your hospital. And I think there are other external agencies in metropolitan cities who help you train on equipments which are used in hospitals, and you can go for an internship in industries as well. But here in industry, when you are limited to a particular product, say the industry is manufacturing just ultrasound, so you're just concentrating on ultrasounds there. So if you go for a training in a hospital, you'll be trained on all the equipments which are present in that hospital, which will help you gain your knowledge more when compared to the industries.
Okay. Thank you, Chethan. Another question is, are programming skills needed in order to get jobs as a biomedical engineer? And if needed, what kind of software skills do we need?
As I said, there are many medical coding jobs as well, which are related to data management and data and regulatory issues in the hospital, whom these medical coders handle too. So for that purposes, you need software, you need programming knowledge as well, which is mainly concerned with Java and SQL. So I hope if you are looking at a career choice of medical coder, you can go with Java or SQL, or there are particular languages which many training institutes can help you learn with. So yeah, for a medical coder, you require software knowledge. Yes.
Thank you. And how will we get updates on latest medical technologies? Like, can you recommend us few sites which gives news on updates about latest medical technologies?
As I said, as I introduced Health Innovations, it is one of our platform in medpick.in. So once you visit our website, medpick.in, you can see a Health Innovations link as well. So when you click it, we introduce one health innovation discovery or a health innovation invention. You can go through that and you can see what are the products which have launched. I think we have come up to 180 products till now. So these products come from US, Israel, North Korea, India, China. It comes with England. So there are these are the products range from so many countries. So you can see all the latest medical technology coming into the market.
Yeah. Thank you. And can a biomedical engineer who is not working in hospitals use the Astra app?
Sure. You can use the Astra app to take up knowledge on medical products if you're not working in any hospital currently. So just register as a biomedical engineer, go access all the products which you can see. I myself, I'm a biomedical engineer. I was not taught of all the medical equipments in my college during my academics. So they concentrate only on very few particular products. And when you come into the market, you are expected to have knowledge on all kinds of products. So here, when you go into our website, you can see each and description for each and every product manuals, data sheets. So you can access all these and see how a product works and what are the core technology in a particular product. So you can gain knowledge, more insights on this. And when you start working in a hospital or an industry, you make use of Medpick much more effectively.
Okay. So we have another question from Ajita Vardhan. She's asking that are Medpick services available all over India?
Yes, we do have Medpick services across India, and to add to that, we have another office in US in Boston. So we do service over there in entire US as well, and we are starting in African countries as well. So we have one starting in Nigeria. So we can provide services across India, across the US, and across Africa.
Okay. So depending on the breakdown, who will we decide AMC and CMC? But do we have any criteria for which all equipment need to give for AMC and CMC?
It depends upon the human resources you have at your hospital, and it depends upon the bed sizes of your hospital as well, and upon the complexity of a particular product. So when a product is not serviceable in a particular hospital and needs to be looked by a industry technician or a manufacturer technician, that is the time you definitely need to have a AMC or a CMC. Otherwise, I think just if a product is less complicated or as simple as a BP apparatus, I don't think we just need a AMC for it. The biomedical technician in a hospital can handle it.
Okay. And the last question, what is the best SW to use in inventory and equipment management register in the hospital?
I'll answer to the inventory management point here. So I introduced our inventory management asset management tool here. So inventory management is a very important thing which most of the hospitals neglect because of the other things happening in the hospitals. And this is what helps hospital to reduce costs or cut costs in procurement. Many of the hospitals whom I know have just left products which are not working just because a diode is not working or a transistor is not working. An entire ultrasound was left alone just because a diode is not working. That's not how you cut costs for a particular hospital. The service may cost just 1,000 rupees for this ultrasound, but here you are going for another alternate option, just procuring and wasting your finances again on procurement. So this is where inventory management can help you a lot. So you have to make sure the assets and inventory in the hospital is properly recorded in a software, which can help you in tagging, which can help you in managing the equipment and the statuses of the equipment. So when, as Prema insisted, when your management comes and asks you how many ventilators are working in a hospital, you should be in a position to answer the exact working condition of a ventilator in a hospital. And this you can do by using a proper asset management software. And there are many asset management softwares in the market which you can use for that purpose as well.
And what are the scope of for biomedical engineers in 3D printing?
3D printing comes a long way in biomedical engineering. In fact, it is taking up all the surgical instrument section, particularly in hospitals. Most of these hospitals currently are looking for cost-effective solutions in terms of instruments and in terms of procurement costs. So this is where 3D printing can help a lot. When it comes to 3D printing, the procurement has to be in bulk quantities. When it is the quantities are very less, it is better to go for conventional manufacturing. But if the quantities are very huge, 3D printing can cut costs on printing syringes or surgical instruments to be very precise. And when it comes to sterilized products, 3D printing can help a lot in manufacturing.
Okay. I'm sure we'll have many more questions coming up. But if you have any other questions unanswered, you can write to us at chethan@medpick.in or contact@medpick.in, and we'll make sure that we answer all your questions one-to-one. And yeah, so on that note, we have come to the end of the webinar. Thank you, Prema ma'am. Thank you, Chethan, for gracing us with your presence.